Patient assessment will vary depending upon the emergency and whether a patient is responsive or unresponsive. The following program will show you the focused history and physical exam for two medical patients, one responsive, the other unresponsive. For a medical patient, get a history of the present illness, a sample history, do a focused physical examination, and get vital signs. Notice that the order of steps is different for medical patients than it is for trauma patients. The purpose, however, remains the same: to conduct an adequate assessment and provide necessary care without delaying transport.
All of a sudden, I got this pain in my chest. It's like somebody's squeezing.
The initial assessment determined this patient was responsive and alert. His chief complaint was severe chest pain. Immediate transport is necessary following the focused history and physical exam. To save time, assessment of the patient's vital signs can take place at the same time as the focused history. For a responsive medical patient, the key is to concentrate on the patient's history and minimize the physical exam.
Do you have any pain anywhere else? Now it's going to take your blood pressure and pulse, okay?
Begin by getting a history of the present illness for more information about the chief complaint.
Respirations are 24 and labored.
Use the letters O, P, Q, R, S, T to help you remember the important questions.
Mr. Jackson, I need to ask you a couple more questions. What were you doing when the pain started?
I was working outside.
Did you fall?
No.
Can you describe the pain for me?
It's crushing and sharp over here.
So you have pressure in the center of your chest, down in your shoulders and your arm.
Yes.
You have pain anywhere else?
No.
How bad is this pain?
It's the worst pain I've ever had.
And when did the pain start?
Oh, about 2 hours ago.
Once you have a history of the present illness, confirm the patient's age and take a sample history.
Mr. Jackson, how old are you?
45. 46 next week.
Pulse is 92 and slightly irregular.
Is there anything else that's bothering you?
I feel a little nauseous.
Have you vomited today?
No.
Any diarrhea?
No.
Look for clues that might explain patient symptoms. Probe for any additional symptoms the patient may not remember to tell you.
Mr. Jackson, did you eat all that food over there?
No, he didn't eat any of it. I had some friends over to watch the game. That's our stuff.
Mr. Jackson, are you allergic to anything?
Cats.
Are you allergic to any medications?
No.
Are these your medications?
Those are my wife's.
Don't hesitate to repeat a question or ask for confirmation if you suspect the patient's response is inaccurate.
Are you taking any medication now?
No. But I did take an antacid about an hour ago.
Did it help?
No.
BP is 152 over 104. Mark, did you call your mother yet?
No, I'll go do it.
Mr. Jackson, you have no previous heart problems
No.
and no medical problems.
No.
Mr. Jackson, we think you need to see a physician. We'd like to take you to the hospital, okay?
Okay.
Just stay right there. We're going to move the stretcher into position and we'll help you onto it.
For a responsive medical patient, a physical exam is usually unnecessary unless your interview reveals possible trauma or another reason to palpate. Take the time to assess adequately, but do not delay transport unnecessarily.
Mr. Jackson, do you have a physician?
Dr. Anderson.
And when was the last time you ate?
Coffee and toast about 6:30 this morning.
Okay.
The focused history and physical exam is the most flexible part of the assessment process. For each situation, you must consider the patient's condition and prioritize elements of the exam to get the most relevant information first.
Respirations are shallow and slow. We'll need an OP airway to assist his breathing.
Okay, I got it.
Watch how the elements of the focused history and physical exam are prioritized for an unresponsive medical patient.
Okay, I'm ready.
Okay?
An unresponsive patient can't give you a description of symptoms, a chief complaint, or a history of the present illness. As a result, the focused physical examination takes priority. It will usually provide the most relevant information about the patient's condition.
No bleeding, no swelling.
When a patient is unresponsive, get a complete focused history or as much information as you can from family or bystanders. Remember OPQRST.
Ma'am, has your husband complained of any headache or dizziness today?
No.
Has he complained of any discomfort today?
No, except to say he was tired.
Do you know of anything that may have triggered this?
No.
Ask only pertinent questions. In this situation, it is impossible to ascertain quality, radiation, and severity of the illness.
Ventilations are adequate. What time did he lie down?
About 2 o'clock, I think. Yes, it was 2 o'clock.
So it's been about an hour.
Yes, I came in about 3 o'clock, and when I couldn't wake him up, I dialed 911 right away.
During a head-to-toe physical exam, use the DCAP-BTLS guideline. Look carefully for swelling, deformities, and medical identification devices.
I need to check his back. We'll roll him on Christine's 3 count.
Okay, can you bag? Sure. And I'll help. Excuse me, ma'am. Thank you.
Okay, is everyone ready?
Ready?
Okay, 1, 2, 3.
Okay, let's bring him back down.
Continue your focused history with the sample history.
Ma'am, has your husband been acting unusual in any way lately?
No.
Has he been feeling tired,
A little tired.
short of breath,
No.
any pain?
No.
During the focused history and physical exam, get a complete set of baseline vital signs.
Pulse 58, strong and regular. Ma'am, does your husband have any allergies?
No.
Is he allergic to any medications?
He's allergic to penicillin.
Does he take any other medication other than for his blood pressure?
No.
BP 160/90. I need to check his pupils. Pupils equal and reactive. Ma'am, your husband should be checked out by a doctor. We're going to take him to the hospital.
Yes, of course.
Okay, guys, let's get ready to move him. Christina, we'll move on your count.
Okay.
Christina, you take the head. George, you take the feet.
Okay.
You ready?
Ready?
1, 2, 3.
Ma'am, has your husband had any medical problems recently?
No.
How about food? When was the last time he ate?
Well, I made him some chicken soup for lunch at noon. He was fine then. Is he going to
Throughout
be
the
all
focused
right?
history and physical exam, be quick and thorough. Get the information you need and transport the patient as soon as possible.
Hey, ma'am, you let us know if you remember anything unusual about what's going on with your husband today.
Okay.
In review, the focused history and physical exam for medical patients takes 2 different forms, depending on whether the patient is responsive or unresponsive.
Do you have any pain anywhere else?
If the patient is responsive, begin with a focused history. Interview the patient to get a history of the present illness and a sample history. If appropriate, do a focused physical exam according to the patient's chief complaint. Finally, get a set of baseline vital signs.
Pulse is 92 and slightly irregular.
Ma'am, has your husband had any headache or dizziness today?
No.
For an unresponsive medical patient, begin with a thorough physical examination. Look for clues to the cause of the patient's condition. Next, get a full set of baseline vital signs.
Ma'am, does your husband have any allergies?
No.
Finally, get as much history as you can from family or bystanders. Any information you gather may be useful to the hospital emergency department. If there are no physical injuries that require immediate care, make the patient as comfortable as possible and transport to the hospital without delay.